right, good morning, Nursing 167. Gonna give you some information for your final, which is on Wednesday. Sorry, my days are off. So watch this video, have any questions, bring it to Skills tomorrow on Tuesday, and I can answer it or explain further or help guide you where to look. All right, so our final is comprehensive. So it will have everything from healthcare delivery all the way up to medications. Material we've covered, applying, your critical thinking, all that comes into play. All right, so let's go over, it's going to be some help guiding you on some stuff you should be looking at. All right, we're looking at the team. Who's on our team? And then who also should you call in reference to a situation with a patient? So for instance, if somebody's having problems swallowing, who do we reach out to? All right, and that's all part of the nurse healthcare team, correct? All right, when we have an emergency situation or like in the ER, and you have to pull respiratory and you have to pull the doctor and you have to pull, everybody else on the team to make the patient healthy or get them stable, they have to collaborate, right? So the collaborative problems are where everybody will pitch in and do their part. So remember, everybody has a specialty. Okay. A couple other things is subjective and objective data. Know the difference and how to recognize it. Charting, your narrative charting, your pie charting. Incident reports and med errors. When and what calls for an incident report, and then medication errors. What do we do when there is a med error? All right, and if the med error was from the previous shift, who's responsible? Is it the previous shift or the current shift? Electronic health records. What's the purpose of electronic health records? All right, and when will there be problems? So if people can't accept it or utilize it, will it be a smooth transition into an electronic health record? And again, what's its purpose? Interventions for education. Okay, what is the best way to do a education? To evaluate that a patient understands their education. All right, and interventions. What interventions can we do to improve a patient's health? So obviously that would be dependent on the situation. Patient refuses to participate in care, they refuse medications. What do we do as a nurse? What is our main thing? Discharge planning, when does that start? And does it just end in the beginning? Assessments. If somebody comes into the emergency room, do they do a complete assessment or do they do more focus because of the situation at hand? All right. Wound care. All right, the stages. Know the stages. Bowel obstructions. Oh, why is that coughing? All right. Incident reports, like I said earlier. Safety. So fall risk, fall preventions, interventions, so preventions and interventions. And what do we do if a patient falls? Okay, or if you find them in the room. Okay, what's our protocol? Holistic nursing. You should know that would have been on there. What are some parts of being a holistic nurse? Remember Maslow's, got to have that physiological first. Then we also have lost my thoughts there. Nursing diagnosis, you know you're going to see that. ADPI, assessment, diagnosis, planning, interventions, evaluation, and expected outcome. Remember, you have your short-term, long-term goal. Okay. Think of the nursing diagnosis we've talked about and make sure it's an actual nursing diagnosis. Remember, nursing diagnosis needs to be related to the problem. So you have your PES statement, your problem, your E, your etiology or your cause, and then your signs and symptoms. Remember, if it's at risk, there are no signs and symptoms. Occupational health nurses, what do we do? What do they do? Okay. So if you think of it, occupational is job. So we got some job related. So if you get a needle stick, do you go to occupational health? And there's an occupational health there, health nurse. Communication. How do we communicate to our patients? Okay, do we call them, say, I'm going to call you this, or would you ask them, how would you like to be addressed? Right, showing them that respect that they need. Hospice nurses. Okay, time frame. Hospice is 6 months or less to live and cares for the family up to 1 year. Remember, so 1 year. All right, angry patients, what do we do? And cultural. Okay, how do we manage culture? What are some key terms, key things we do as a nurse? The nurse-patient relationships, what's some of the objectives of that, and how do we get that to occur? Verbal and nonverbal communication techniques, so be familiar with that. Education, so remember diabetes, when you have impaired areas, what are some interventions we would educate or go over with our patients? Safe health environments, what do they consist of? Definition of what a disaster is. What is that? PPE, what's the purpose of PPE? Okay, medications, the inhalers, know how to use them, the steps, when do you wash them out, rinse out, and which one goes first. All right, needles, PPD, TB, intradermal is 10 to 15 degrees, subcutaneous 45, IM is 90. The most safe site for the IM is your ventral gluteal. Subcutaneous, 2 inches from around the belly button. All right, and they need to be in, you're going to pinch an inch, 45 degrees, bevel up. Therapeutic range, toxic range, subtherapeutic. Know those three and recognize. So what does it mean when a medication is subtherapeutic? What it means when it's therapeutic, and what does it mean when it's toxic? And be familiar with the medications that were in that list for toxicity. Can we just give a medication and say, hey, I have a headache, can I have some stuff? What do we need? Drug diversion. What was drug diversion? That definition. Allergies. What's one of the, how do we verify a patient's allergies, and what do we do if they say they are allergic to something? Xlair. When you have a medication, so an Xlair, why and who would we not give it to? And what would be the reasoning? Why do we rotate the sites for our subcutaneous injections? Okay, bowel elimination. When you think about bowel elimination, what are some of the normal factors that we would want for bowel elimination? So environment would make a big thing. What else? Position. So all those will play a role. All right. What's Crohn's disease? What would the stool look like? Ulcerative colitis, and what would the stool look like? Okay. Diverticulosis. What's a severe complication of diverticulosis? Which is diverticulitis, which just says what is a severe complication of that? Lactose intolerant, celiac, be familiar with those. What does that refer to? What do you see? What kind of symptoms do you see? And what would be the reasons that patients have a greenish black stool? Colostomies, what does the stoma look like? What would be if you had a patient who had a colostomy and then all of a sudden kept having a lot of gas? Think of the foods that cause excess gas and odor. So onions. So, if we eat onions or garlic and you burp, doesn't it come up like onions or garlic? So you think of those type of foods that have odor and gas to them. Okay, would you educate your patients on avoiding those type of foods or consuming more of those foods if it has that odor and leaves that taste if we burp? So just think of the colostomy, that same odor, if we burp, is going to come out through that colostomy. Know your 4 stages of wound care. Stage 1, stage 2, stage 3, stage 4, unstageable. So 5 stages. All right. The drainage, sanguinous, serosanguinous, serous, purulent, what each one of them mean. Clay-colored stool, sorry, went back on my note section, my brain. What is clay-colored stool? Dressings. Be familiar with the hydrocolloid dressing. Read up on that. Okay, why do we use that dressing? Okay. Dehiscence and evisceration. Know those 2 key terms and be able to recognize it. How does recognize a pressure injury. All right, what are some ways we can recognize pressure injuries in dark-skinned individuals? Okay. What interventions do we do to prevent pressure ulcers? How long can they occur in? And therapeutic communication in all of those medications, bowel, wound, teaching, nursing, diagnosis. All right, guys, I hope this helps. I will post this up in Canvas. Hopefully you watch it. And if you have any questions, we will talk more about it tomorrow in class.